Now imagine some American who is in poor health and can't afford medical care. Some American who is elderly and in need of trouble, or maybe not elderly, something's gone wrong. Someone who is trying to work but can't get a job that has health insurance, someone who is in difficulty. Do we believe that that's their problem, that we should not be taking care of them? And by the way, we're not just talking about the 45 million people without health insurance. We're also talking about the roughly 75 million people who have inadequate health insurance that basically crumples whenever it's put to the need. We're talking about a large part of this country that does not have adequate health care coverage. Well, I would submit to you that actually as a nation, we don't believe that it's appropriate to leave these people on their own, that we actually believe that the right thing to do is to help people. We don't think that people should be protected from all of the risks of life, but when there is something you can do, we believe that we should do it.
It is intuitive to think that it should, that we have very poor and helpless people, and it's the job of government to help them. And actually, we have that. We have Medicaid. If you are poor, you are covered in America. It's not a good system. It's tempting to think that a wise government could step in and look at Medicare. People like Medicare. And that's true. But of course they like it, because it gives you stuff free. People like that. But it's unsustainable. It's $35 trillion in the hole. That's the unfunded liability of Medicare. They made promises to cover us when we're 75, when the panel is 75. There's no way they can possibly do that. Right now it's working because there are lots of young people and relatively few older people, but there's just no way it can be sustained. If a private company tried to run its pension system that way, I bet they'd throw the owners in jail.